Module 4, Performing the Mammography Exam, Craniocaudal CC Positioning and its Modifications. For our volunteers' privacy, they are clothed in camisoles during the demonstration of each exam technique. The standard screening mammogram consists of 2 views of the breast and attempt to visualize all of the breast tissue. The craniocaudal, also known as CC view, and the mediolateral oblique, also known as MLO view.
It's very important to have the patients understand that the need of a good mammogram, we don't want to miss anything as far as the imaging is concerned. We provide a high quality of standard of care, and it's important that we see every square inch of the breast tissue. We will find a way to get it on there.
As a technologist, our patients are the greatest resource for how to get an exam done. They know what they can do and what they can't do. And when they share that with you, it's up to you to make it work.
The CC view is frequently the easier of the 2 views to perform, as it can be accomplished with a patient standing, sitting, or lying down. However, depending on a patient's physical limitations, modifications may be necessary, as demonstrated in this module. Prior to performing the mammogram, the technologist will verify the patient's correct identification. Next, the technologist will review the patient's breast health history, including history of pregnancy, last menstrual period, breast surgery, any history of breast cancer, and possible presence of breast implants. The technologist will also well inquire about the patient's prior mammography experience. This will facilitate a partnership, necessary to obtain a quality exam. In this footage, you see a standard CC view being performed with an anonymous volunteer. In maintaining the patient's privacy as much as possible, the technologist has her patient only open her gown on the side to be imaged. The technologist has the patient step towards the machine, where the technologist then lifts and positions the breast on a mammography platform. Care is taken to position the breast to include as much of the medial, inferior, and posterior breast tissue as possible. The technologist then uses her hand to bring additional lateral and superior breast tissue onto the plate as she begins to apply compression. While applying compression, the technologist communicates with the patient to ensure her comfort and not exceed pressure as tolerated by the patient. Here, the breast is optimally positioned with inclusion of the medial cleavage as well as lateral tissue of the breast. Many of your patients with disabilities may present to your facility using a wheelchair or scooter. Generally, a well-positioned CC view may be obtained with a woman seated in her own assistive device. Some of your patients may have additional functional limitations. Judy, our patient here, informs her technologist of the limited mobility of her left arm.
Now, don't forget this arm doesn't...
Right.
The technologists and patients work as a team to coordinate the adjustment of the mammography unit and positioning of the scooter.
Drive it forward. That's good.
Perfect.
Additional considerations may be needed for supporting the patient during the exam, such as placement of a back cushion or pillow. In some cases, it may be difficult to adequately include all the necessary breast tissue when imaging the patient in a seated position. In these cases, the technologist may alter the angle of the X-ray tube and detector or have the patient rotate to capture the necessary portion of the breast. In order to visualize more of the posterior lateral breast tissue, the technologist obtains a laterally exaggerated CC view by having the patient rotate her scooter seat or her upper torso, as well as angling the X-ray tube and detector to a shallow 10 degrees.
This arm out of the gown. Good. You're doing great. I'm going to have you lean all the way in here, okay? Good. Perfect right there.
Here you see a CC view on the left and an XCCL view on the right. Notice the greater amount of posterior and lateral tissue included on the XCCL image. In order to obtain a CC equivalent with a patient lying down, it is frequently necessary for the technologist to rotate the X-ray tube and detector, with the imaging being performed from the bottom to the top of the breast, commonly known as the from below or FB view. For the right from below view, the patient lies on her left side, which may require the technologist to add supportive cushions. The top of the breast is positioned against the detector as the patient reaches with her right arm to rest on the machine. The technologist then lifts and massages the inferior portion of the breast forward to maximize the amount of tissue imaged. Compression is applied from the bottom of the breast. While applying compression, the technologist supports the patient's back or may place a cushion if needed. In the next module, we will examine the second screening mammography view, the MLO view, and its additional modified alternatives.